chart so I don't miss anything out, okay?
Sure.
So you're 28 years old,
Yes.
you live in the States,
Yes.
and you're single.
Yes.
Do you have any children?
No.
Okay. In your pathological records, I see that you have some gastrointestinal troubles with severe food intolerance. Anything else?
Um. Yeah. I mean, there's like quite a few symptoms, meaning like I can't speak too much because my head builds pressure when I talk for, let's say, more than 30 minutes.
Oh yeah, but I mean chronic diseases such as hypertension, diabetes, cancer, anything like that.
Oh no, nothing like that. That's diagnosed. No.
Okay. Are you currently taking any medications?
No.
Yeah, allergic medication.
Sorry. It broke up for a second.
Are you allergic to any medication?
No, not that I know of.
In your surgical records, I only have that you had a gallbladder removal on 2020, right?
Yes.
And are you currently using blood thinners?
No.
Okay, perfect. So, yes, let's continue. So, when you talk, you feel like your pressure inside your head is increasing,
Yes.
right? For how long has this happened?
Um, it got really worse in 2019 and 2020.
And it has been since 1 year, 2 years, 3 years.
It's been slightly there for a couple of years, but it's very mild. It was hard to tell. I could still talk all day. Um, Last year I had an episode where I couldn't talk like almost much at all, like not even 10 minutes for like about a month. That's when I changed my diet to be AIP protocol, and that helped. But this year, it's even with the diet, it's still very sensitive.
Perfect. I also saw that you referred to some pain in your fingers, your hand, your wrist when you use your computer or your phone.
Yeah, so currently I use my computer using my foot um, with the foot mouse. I can't type a lot, just little like passwords in here and there. Um, and and yeah, I have like pain and stiffness in my hands, wrist, feet, toes, all the toes, shin area, like tightness and pain. I can't walk a lot, like maybe 1 or 2 blocks at a time. And then if I walk more, like let's say quite a bit, like 5, 6 blocks or more, then I have pain for like a couple of weeks. And yeah, that's kind of the pain.
And has your GP described it like fibromyalgia, MS, ALS, sorry, um, carpal tunnel syndrome, any of those?
So I got a test for carpal tunnel. It didn't like I did it didn't pass for carpal tunnel. Um, and I never got diagnosis for anything with MS or fibromyalgia or anything like that. But I never got tested for
For
them.
the
Sorry.
never tested for MS, ALS.
No. I don't really know where to get tested for that. So I never
Okay,
got to be able to, unfortunately, get a diagnosis.
okay, perfect. Okay. And your food intolerance, tell me a little bit about it.
So the food is very sensitive now. Um, so to give you an example, like last year I could eat some vegetables like carrots, um, spinach and stuff, but nowadays I can't eat almost any vegetable. Earlier this year, even I used to be able to eat a soup in the morning, and over the last couple of days, the soup has been having a lot of reactions. Even for simple fruits like a banana or a carrot, I get vertigo within like 10, 15 minutes. and like spinning, and also loss of balance, and also loss of like coordination. I realized like days when I eat like anything like that, like a fruit or like a carrot, like I just can't write. Like I scrabble, like when I try to just write, I just there's my hands can't follow with what I'm trying to write. It just scribbles past, and I don't have any coordination. Also, like um, it's just like the coordination is just really off. Like for example, I kind of bump into like doorways when I'm trying to just normally walk through, because my estimation of like the distance between my shoulders and the door, where the door, stuff like that is kind of like
Yeah,
off.
right.
Yeah, I just like bump into stuff. I have to just like the coordination is really off. And this is from very normal foods like a carrot or a piece of a banana or like some spinach or like um, if I eat like, I mean, I can't eat most foods. Right now, I eat two things only. I eat a wild caught salmon, sweet potato, salt, and water. These are the four elements I eat right now.
Okay, okay. Okay, so usually we don't tend to treat people with no diagnosis, because sometimes, for example, in the case of ALS, when ALS patients receive stem cell treatments, they tend to get worse. But I'm going to propose that we give an IV stem cell infusion to you with some of our special IV drips and the hyperbaric chamber. But this will have to go through the whole medical staff, and that they accept it. If you do have some testings, maybe that you have forgotten about, a spinal tap, brain MRI, or some notes from your neurologist, it will be great to have those, so we can get out like an idea of what's going on. Um, so I'm going to tell you a little bit about our cells. We use Wharton's jelly umbilical cord mesenchymal stem cells. These cells, we do not use embryonic tissue or blood from the cord. We only use Wharton's jelly, which is the connective tissue in the umbilical cord. The main differences between our cells and what you can find in the States or in Europe is that over there you can only get cells from your own fatty tissue or your own bone marrow. And this has several limitations. First, your cells are going to be as old as you are, as our cells are 0 years old. And those procedures, the liposuction or the bone marrow aspiration, are quite painful. The quantity of cells that you can obtain is unsure. You won't get more than maybe 5 million cells, as I am proposing to give you an infusion of 150 million cells. Um, the other part is the viability of the cells, because over there you might ask your doctor, how many cells am I getting? And he's going to be like, I don't know. How viable are the cells? How alive and working are they? And he wants to know either. As we have the lab on premises on the clinic, we can assure you that we are giving you the exact amount of cells, and that with our viability is over 90 to 95%. So it's quite a high number in viability, and we are also guaranteeing you that, and we'll give you at the end of the week a quality certification for the cells stating so. What else shall I tell you? The special IV drips, we use them for detox, even gastrointestinal detox. And so, by doing a detox of your whole body, we are going to be able to generate a better environment and microenvironment for yourself to work with our cells, right?
Right.
And with the hyperbaric chamber happens the same thing. We are going to provide you with real high concentrations of oxygen into your bloodstream, and that way we are generating also a better environment cells have a characteristic, and it's that they are immunoregulatory, meaning that they can like regulate your immune system, so it goes easy on you. Because if you have an autoimmune condition, was it Shelley? Your
Sure.
patient advocate? Yes, Shelley. So Shelley wrote in the consultation request, she said that you had autoimmune conditions. Some of them sound autoimmune, but the others will certainly have to be studied. Um, in imaging, MRIs of the brain, maybe spinal taps, blood works, because, well, you cannot be without a diagnosis, right? Um, so yeah, that's the treatment that I'm proposing, IV stem cells, but it'll have to be approved by the rest of the medical staff, um, because we don't really know what you've got. But this is the only kind of treatment that I could offer you in that state. Okay?
Got it. In terms of like when you said patients with ALS, it's like when you said it worse, it's like it's because it was like a something to have an aggravation or like some kind of reaction that was like temporary or like permanently worse.
Permanently. And we don't know why yet, but MS patients have responded good to the treatment, but ALS patients don't.
Interesting. Okay. Yeah, the difficulty is that I have like symptoms from both of those things. Um,
Exactly,
yeah, right.
exactly. So that's the reason I would like to know exactly what you have. So if you go to a neurologist or something, it will be great for the treatment.
We went to several neurologists. They said
Okay.
nothing. I did MRIs from my head in three different ways with CAT scans and everything. There was nothing.
Okay. So I'm gonna make sure I put that on my clinical chart, and so when the rest of the medical staff examines it, they know that you have been already tested, but you don't have that. Um, so yeah, that's about the treatment that I will propose to you. Maybe you have any questions regarding the treatments, the cells.
Um, Not really. I've been researching a little bit. It does seem like a very good thing for me. Um, and yeah, this is umbilical cord stem cells. And yeah, I mean, I don't really have any questions. It's basically like it's for a week, right? 1 week, um, and we have like different days when we do each stem cell, and like and how long after you do one session can you tell the effects? Like,
Okay, we usually give it a time frame of about 3 to 6 months to see how everything's going. Um, but yes, we expect to see the results in about 3 to 6 months.
got it. Okay, makes sense. Okay, that's pretty much it. That's all the questions I have really.
Okay, perfect. So I'm going to get to work on your protocol, so I can send it to medical staff and have it approved as soon as I can, or maybe they'll ask for um, test results that you send it to us, so we can take a look. But it all depends on this, and so I'm going to get to work on it, so and see what the rest of the team has to say. Okay.
Okay, so actually, I have one last question.
Sure.
For has there been where somebody used it directly for their gut, like stem cells in the gut, and it healed the gut?
No, and that's why we use the ID ones.
Okay, okay, got it. Makes sense. All right.
Okay?
Thank you very much. Have a good one.
Okay, perfect. Uh, so we'll speak later if we have to, okay?
Okay, all right. Looking forward to it.
Okay.